எப்படி தம்பி ரீநேம் பண்றது என் நேம்?
Good evening, everyone. Since only 20 participants have joined, we'll wait for a while for more participants to join.
Duty.
Good evening, everyone. It feels great to meet you all once again today in our quest to master the competencies, specific learning objectives, domains, levels of proficiency, and teaching learning methods. I'm Dr. Deepthi Shastri and the faculty moderator for today's session. Just to recap, we have hitherto reviewed competencies in general anatomy, upper limb, lower limb, thorax, abdomen, pelvic cavity and perineum, and neuroanatomy. We will be discussing head and neck competencies today and this Saturday, and that will leave us with histology, embryology, and genetics for the next week. All of you, in spite of the heavy workload that has ensued due to COVID-19 pandemic, have been doing a wonderful job of framing SLOs, reviewing them during the online synchronous sessions, as well as Google Classroom. Thank you for the involvement you have shown in all the sessions. Well, let's get started with today's session. Today, we'll be taking up competencies 26 to 35 in the head and neck region. And the presenters are Dr. Sharmila Banu from Group G, Dr. Saujanya from Group H, Dr. Mahima Sophia from Group B, Dr. Divya from Group E1, Dr. Supriti from Group E2, Dr. S. Shantini from Group D, Dr. Archana from Group K, and Dr. Chandini Gupta from Group J. We'll move on to Dr. Sharmila. Dr. Sharmila, do you want to share the screen or shall I share the competencies?
Madam, good evening, madam. I will share my screen, madam.
Okay, I'll stop sharing so that you can share.
Okay, okay, madam. Madam, is
Yes,
it visible,
Dr.
madam?
Sharmila, it is visible. Can you just enlarge it a little bit?
Okay, one second. Is it okay,
Yes.
madam, now?
Yes.
Okay. Shall I start, madam?
Yes, please go ahead.
Okay. So, good evening, one and all. So, the first competency, the topic of skull osteology. It is describe the cranial cavity, its subdivisions, foramina, and structures passing through them. The domain, it is know and skill. The level of the competency should be, it is knowledge first, it is knowledge, know how, and show how. And the core competency level, it is the essential, that is why. So coming to the specific learning objectives, the first one is enumerate the bones forming the interior of skull. Second SLO, enumerate the subdivisions of the cranial fossa with its boundaries. Third one, describe the bony landmarks, foraminas in the anterior, middle, and posterior cranial fossa. Fourth, enumerate the structures passing through various foramina. Fifth, give the anatomical basis of black eye, CSF leak, bleeding from nose, ear due to fracture involving the base of skull. So then teaching learning methods, lecture, DOAP, and then assessment methods will be Viva OC, skill assessment, that is practicals. So this is about the AN 26.3 competency. I thank my guide, Dr. Nidhi Puri Madam, for giving this opportunity to present this competency. Thank you.
Thank you, Dr. Sharmila. Next, we move on to Dr. Saujanya from Group H. Dr. Saujanya, would you like to share the screen?
Ma'am, please share the screen, ma'am.
Okay. (27.1), right?
Yes, ma'am. Yes, ma'am. See, good evening to one and all. So the competency is AN 27.1. So the competency is describe the layers of scalp, its blood supply, its nerve supply, and surgical importance. So it is knowledge and knows how. It's a core competency. So at the end of the session, phase 1 students should be able to know the following SLOs. So definition of scalp, the extent of the scalp, different layers of scalp and their composition, arterial supply of the scalp, venous drainage of the scalp, nerve supply of scalp, surgical importance of different layers of the scalp, and the clinical correlation. So it's both the lecture, didactic lecture, as well as small group discussion in the practical, in the dissection. The next competency is AN 29.1. So the competency is describe and demonstrate attachments, nerve supply, relations, and actions of sternocleidomastoid. The domain is knowledge as well as skill. It show how it's a core competency. So at the end of the session, the first year student should be able to locate the sternocleidomastoid muscle, with its origin and insertion, nerve supply and action of the muscle, superficial and deep relations in different areas, and the clinical correlations of the muscle and steps of dissection to display the muscle. So the teaching learning method is a lecture, a practical hour, that is a small group discussion, DOAP session. So I thank my guide, Dr. Anjali Sabnis Madam, for giving me this opportunity to present these SLOs. Thank you, one and all.
Thank you, Dr. Saujanya. Next, we move on to group B, Dr. Mahima. You'll be sharing the slide, right?
Ma'am, can you able to hear me?
Yes.
Ma'am, can you able to hear?
Yeah, we can hear you, Dr.
Yes,
Mahima.
Yes,
You
ma'am.
can share the slide. You want to share the slide,
Yes,
right?
ma'am. I will share.
Yeah,
Ma'am.
yeah, please do.
Ma'am, can you able to see?
It's starting to open. Yes, we can see.
Oh, okay, ma'am. Thank you, ma'am. Good evening, all. On behalf of Group B, I'm here to present on the competency face and parotid region, that is AN 28.3, that is describe and demonstrate origin, formation, course, branches, tributaries of facial vessels. First SLO is describe the origin, course, relations, branches, anastomosis, and applied anatomy of facial artery in face. And next SLO is explain the formation, course, relations, termination, and tributaries of facial vein and retromandibular vein. Here the domain is knowledge and competency level is knows how, and it is a core competency. And various teaching learning methods for this SLOs are large group interactive teaching, large group didactic lecture, video demonstration, and small group teaching. Next, coming to the third SLO, identify facial artery, transverse facial artery, facial vein, and retromandibular vein in a cadaver correctly. And fourth SLO is demonstrate the origin, course, relations, and branches of facial part of facial artery in a cadaver. Demonstrate the formation, course, relations, termination, and tributaries of facial vein in a cadaver. And here the domain is knowledge and competency level is knows how and shows, and it is a core competency. And by various teaching learning methods for this SLOs are practical by dissection method and small group discussion, DOAP, and self-directed learning. And sixth SLO is demonstrate surface marking of facial artery and facial vein in a cadaver correctly. Domain is knowledge and competency level is knows how and shows, and it is also a core competency. And teaching learning method for this particular SLO is DOAP and small group discussion. And I would like to thank our resource faculty, Dr. Gunapriya ma'am, for her constant guidance. And I also would like to thank all the resource faculties for giving me this opportunity. Thank you once again.
Thank you, Dr. Mahima Sophia. Dr. Divya, I'll share the screen for you.
Yes, ma'am. Good evening, all. First of all, I would like to thank all our teammates from E1 group and our mentor, madam, Dr. Sheila ma'am, for giving me this opportunity to present in this forum. Ma'am, am I audible? Shall I proceed?
You are audible. Please proceed.
Thank you, ma'am. Yeah, the competency, what we are going to discuss now is AN 30.1 in cranial cavity. Describe the cranial foci and identify related structures. It's a core competency. What the objectives what we have framed are totally 4. At the end of the teaching learning session, the first year MBBS students should be able to, first objective is enumerate the subdivisions of cranial foci. Second one, list the bones forming the boundaries of each cranial fossa. Third one, describe the structures related to each cranial fossa. All these 3 objectives, they come under knowledge domain and their proficiency level is knows. And the teaching learning method is a small group discussion. The fourth objective is identify the structures related to each cranial fossa. The domain is knowledge and skill. The proficiency level is shows how. The teaching learning method is demonstration on a practical session. So here I would like to place a point here for discussion. The thing is the competencies 26.3 what discussed now previously, and this 30.1 and one more competency is there 30.2, that is describing and identifying major foramina. All these three competencies, they have the same contents. So that point I would like to place here for discussion, ma'am. Thank you, ma'am. Thank you for giving me this opportunity. Thank you.
Thank you, Dr. Divya. Dr. Supriti, you will be sharing your own slides.
Yes, ma'am. Am I audible, ma'am?
You are. Please share your slide.
Yes, ma'am. Is it visible, ma'am?
It is visible.
Okay, thank you, ma'am. A very good evening, one and all. Myself, Dr. Supriti Bhatnagar. I'm here to present competency number 31.4. But before that, I would like to thank our resource person, Dr. Sheila ma'am, for giving me this opportunity. And a special note of thanks to our group members for their valuable inputs in preparing and refining these SLOs. Now, let us see the competency 31.4, which is enumerate the components of lacrimal apparatus. It is a core competency. The SLOs which are formulated for this competency are number 1, enumerate components of lacrimal apparatus with neat label diagram. Number 2, describe the parts, anatomical features, blood supply, nerve supply, and applied aspects of lacrimal gland. Number 3, explain the innervation and blood supply of lacrimal apparatus. Number 4, explain the anatomical features of lacrimal sac. Number 5, describe the formation, course, and termination of lacrimal duct. Number 6, discuss the development, congenital anomalies, and applied aspect of lacrimal apparatus. All the SLOs come under knowledge domain, and the proficiency level for all the SLOs is knows, except for the last SLO, where level is knows how. And the preferred teaching learning method we identified for these SLOs are interactive lecture, small group discussion, videos, problem-based learning. And one more teaching learning method is flipped classroom with PPT in LMS, which can be used for last SLO, which is 31.4.6, where we discuss the clinical aspects. This is all about my competency. Thank you all for listening.
Thank you, Dr. Supriti. Will you stop sharing this slide?
Yes, ma'am.
Next would be Dr. Shantini. You will be sharing your slides, Dr. Shantini.
Yes, ma'am. Good evening, ma'am. Am I audible, ma'am?
Good evening. Yes, you are.
Ma'am, I'm sharing my screen.
Yes, please.
Ma'am, whether the screen is visible?
It is visible, Dr. Shantini.
Okay, ma'am. So I'm starting. So good evening, everyone. I'm Dr. Shantini. I'm a presenter representing Group D. I'm here to present on competencies AN 32.2 and AN 33.3, which comes under the topics anterior triangle and temporal and infratemporal fossa of the head and neck regions. Both these competencies are core competencies. So competency AN 32.2 is describe and demonstrate boundaries and contents of muscular, carotid, digastric, and submental triangle. The SLOs framed are, so at the end of this session, the phase 1 MBBS student should be able to identify the SLOs. 2.1, describe the boundaries and contents of muscular triangle with at least one of its applied aspect. 2.2, describe the boundaries and contents of carotid triangle with at least one of its applied aspect. 2.3, describe the extent, formation, and contents of carotid sheath with a neat label diagram and mention at least one of its applied aspects. 2.4, describe the boundaries and contents of digastric triangle with at least one of its applied aspects. 2.5, describe the boundaries and contents of submental triangle with at least one of its applied aspects. 2.6, draw a neat label diagram of boundaries and contents of carotid and digastric triangle. 2.7, describe attachments, nerve supply, actions, and development of digastric, mylohyoid, homohyoid, and stylohyoid muscles. So all these 7 SLOs, it comes under the domain knowledge, and proficiency level is nose. And the preferred teaching learning method is lecture bar small group discussion. So 2.8, so identify the boundaries of all subdivisions of anterior triangle in a prosected specimen or cadaver. Domain is knowledge and proficiency level is knows how. 2.9, identify the contents with their relations in each subdivision of anterior triangle in a prosected specimen or cadaver. So domain is knowledge and proficiency level is knows how. The preferred teaching learning method is small group discussion with dissection. Then the second competency is AN 33.3, describe and demonstrate articulating surface type and movements of temporomandibular joint. The SLOs framed are 3.1, define and classify the temporomandibular joint. 3.2, explain the bony articular surface forming the temporomandibular joint. 3.3, describe the capsular attachments and the ligaments supporting the temporomandibular joint. 3.4, explain the structure and morphology of articular disc of temporomandibular joint. 3.5, explain the role of articular disc in dividing the joint cavity. 3.6, discuss the relations, blood supply, nerve supply, and lymphatic drainage of the temporomandibular joint. 3.7, describe the various movements occurring at temporomandibular joints with the muscle producing it. 3.8, explain the factors maintaining stability of the temporomandibular joint. So all these 8 SLOs, they come under domain knowledge and proficiency level knows. 3.9, explain the anatomical basis of locked jaw. Domain is knowledge and proficiency level is knows how. 3.10, demonstrate movements of temporomandibular joint and perform bilateral digital palpation of the joint in a human volunteer. So here domain is knowledge, knowledge bar skill, and proficiency level is shows how. So first 9 SLOs, the preferred teaching learning method is lecture bar small group discussion, whereas SLO 10, it is the dope. So that's all. I conclude my presentation. So my sincere thanks to my resource faculty, Dr. Angela Madam, for giving this opportunity and for her valuable guidance. And I thank all my group members for their contribution in framing and refining these SLOs. Finally, I thank all our senior resource faculties for providing this unique platform and guiding junior anatomists to appraise ourselves to the next level. So thank you for your patient listening. Thank you, ma'am.
Thank you, Dr. Shantini.
Yes,
Will
ma'am.
you please stop sharing your screen?
Yes, ma'am. Yes, ma'am.
Dr. Archana, will you be sharing your slides?
Am I audible, ma'am?
Yes, Dr. Archana.
Yes. Good evening, one and all. I'm Dr. Archana, and I'll be presenting the SLOs framed by Group K under the able guidance of Dr. Punita, ma'am. And the topic is submandibular region. And we have 2 competencies here. I'll be discussing the 34.1 competency, that is describe.
Dr. Archana, you're not very audible. Can you please speak into the mic if you have?
1 second.
Yeah.
Am I audible now, ma'am?
Yes, yes.
Is it clear, ma'am?
Yeah, better. Please go on.
34.1, describe and demonstrate the morphology, relations and nerve supply of the submandibular gland and submandibular ganglion. It's a core competency, and at the end of the learning session, the first MBBS student should be able to describe, the first SLO is describe the morphology, capsules, and relations of the submandibular gland. The domain is knowledge, K, and the proficiency level is K. And the teaching learning methods would be lecture or small group teaching, and we can have an integration, vertical integration with general surgery department. And the second SLO is draw a well-labeled diagram of the relations of the superficial and deep parts of the submandibular gland. Domain is K, and the level is SH, and the teaching learning methods could be a small group teaching or a self-directed learning. And the third SLO is list the nerves and vessels supplying the gland. Domain is K and the level is K, and the teaching learning methods would be interactive lectures, SDLs, and SGT. And the fourth SLO describe the course, relations, and termination of the submandibular duct. The domain is K and the level is K, and the teaching learning method would be an interactive lecture or a small group teaching. And the fifth SLO state the location, relations, and type of submandibular ganglion. The domain and level would be K, and the teaching learning methods is small group teaching or a self-directed learning. Coming to the sixth SLO, draw a well-labeled diagram showing the relations of submandibular ganglion. Domain is K and the proficiency level is SH, shows up. And the teaching learning methods would be small group teaching or a self-directed learning. And the seventh SLO, name the cranial nerves associated functionally and topographically with the submandibular ganglion. Domain is K and the proficiency level is also K. And the teaching learning method would be an interactive lecture or a small group teaching or a self-directed learning. And the eighth SLO, discuss the nucleus of origin, secretomotor pathway taken by pre and post ganglionic fibers of the submandibular ganglion. And the domain is K and the level is KH. The teaching learning method would be a lecture, small group teaching or a self-directed learning. And the ninth SLO, draw a well-labeled diagram showing the secretomotor pathway of the submandibular ganglion. Domain is K and level is SH. And the teaching learning methods would be SDL or small group teaching. And the 10th SLO, enumerate the muscles of the submandibular region. And the domain would be K and the level is K. And teaching learning method would be an interactive lecture or a small group teaching or self-directed learning. 11th SLO, demonstrate the two parts of the submandibular gland with its relation to the mylohyoid muscle. Domain is S and the level is SH. And the teaching learning method could be a practical dissection or a DOAP session. And the 12th SLO, demonstrate the relations of the deep part of the submandibular gland to the structures related to the hyoglossus muscle. Domain is S and level is SH. And the teaching learning method would be a practical session or a DOAP session. And 13th SLO, demonstrate the submandibular duct and its relation to the lingual nerve and artery. Domain is S and the proficiency level would be SH. And the teaching learning method would be either a DOAP session or a practical session. 14th SLO, demonstrate the submandibular ganglion with its pre and post ganglionic fibers. Domain is S and the level is SH. And the teaching learning method would be either a practical session or a DOAP session. And 15th SLO, demonstrate the bimanual palpation of the submandibular gland in a cadaver or a human volunteer. So the domain could be either S or C, and the proficiency level is SH. And the teaching learning method is either a practical in a skill lab. And we can have a vertical integration with general surgery department. And I thank Dr. Punita ma'am and all my group members for giving me this opportunity. Thank you, ma'am.
Thank you, Dr. Archana. Can we have the last presenter for the day, Dr. Chandini from Group J? Dr.
Yes, ma'am. Yes, ma'am. I'll share my screen.
Okay.
Yes, ma'am.
Dr. Archana, can you please stop sharing your slides?
Ma'am, is it visible?
Yes, it is.
Yes, ma'am. Okay. So my competency was AN 35.1, and we have divided into SLOs. So I will read out the SLOs. The first SLO is, my competency is describe the parts, extent, attachment, and modifications of deep cervical fascia. So we have divided them into SLOs. The SLOs are enlist the layers of deep cervical fascia, and the domain is K, level is K, and actually it's a core competency. The teaching learning methods are lecture and small group discussion. The second SLO is describe the attachments, vertical and horizontal tracing of the investing layer of deep cervical fascia. Domain is K, level is KH, knows how, and teaching learning method is lecture and small group discussion. The third SLO is enlist the spaces, gland and muscle enclosed by the investing layer of deep cervical fascia. Domain is K and the level is K, and the teaching learning method is lecture and small group discussion. The fourth SLO is mention the two thickenings of the investing layer of deep cervical fascia. Knowledge is, the domain is K and the level is K, and the teaching learning method is lecture and small group discussion. Then the fifth SLO is list the facial slings and facial processes formed by the investing layer of deep cervical fascia. Domain is K and the level is K, and the teaching learning method is lecture and small group discussion. Then the sixth SLO is draw a label diagram showing the vertical and horizontal tracing of investing layer of deep cervical fascia. Domain is K, level is knows how, and it can be done either by SDL or small group discussion. Seventh is describe the horizontal and vertical tracing of pretracheal layer of deep cervical fascia. The domain is K, level is knows how, and the teaching learning method is lecture and small group discussion. Eighth SLO is illustrate with label diagram the vertical and horizontal tracing of pretracheal layer of deep cervical fascia. Domain is K, level is knows how, and it can be either done by SDL or small group discussion. Ninth SLO is mention the position and attachment of ligament of Berry with its relation to recurrent laryngeal nerve. Domain is K, level is knows how, and it can be either done through lecture or small group discussion. 10th SLO is describe the horizontal and vertical tracing of prevertebral layer of deep cervical fascia. Domain is K, level is KH, and it can be either done by lecture or small group discussion. 11th SLO is draw a label diagram for the vertical and horizontal tracing of prevertebral layer of deep cervical fascia. Domain is K, level is knows how. It can be either done by SDL or small group discussion. Then 12th is mention the formation and content of axillary sheath. Domain is K, level is knows how. It can be either done by lecture or small group discussion. 13 is describe the formation and extent, relation and content of carotid sheath. Domain is K, level is knows how. It can be either done by lecture or small group discussion. And the last one is draw a label diagram of the transverse section of the neck showing the dispositions of the layer of deep cervical fascia at the level of isthmus of the thyroid gland. Domain is K, level is knows how. It can be given as a SDL. Done, ma'am. Thank you. And I thank Dr. Rajshri for helping me in this. Thank you.
Thank you, Dr. Chandini. Can you please stop sharing the screen? I would request all the presenters to please keep your, please be close to your laptops, because you will have to share your screen when reviews go on. At the outset, I would like to congratulate all the groups and presenters for an elaborate framing of SLOs. And before we start with the reviews, I would like to make a special mention of Group G, who framed 183 SLOs in all for the topic skull osteology. So congratulations everyone. We'll start with the reviews. We'll start with review by Group A for Group G. Shall I share this slide screen, Dr. Sharmila?
Hello.
Dr. Sharmila?
Madam. Yes, madam.
I'll share the slide screen, right? Yeah.
Okay, madam.
So from Group A, anyone would like to review? Group A? If Group A, okay. Dr. Lakshmi, would you like to review? Anybody else would like to review?
Shall I?
Yes, ma'am.
I just wanted to know whether the fifth one, the anatomical basis of black eye, is it relevant here in the cranial cavity? Because I think we discussed that during the scalp also. So just a query.
Yes, ma'am. Even I thought it could be related to soft tissue. Then probably they mean fracture of the frontal bone. I don't know, because it is cranial cavity. It somehow it didn't gel, black eye with the cranial cavity.
Yeah, that's what even I felt so.
Yeah. Dr. Sharmila, would you like to take?
Yes, madam, the same thing only, madam, because anterior cranial fossa, frontal bone can be involved, so that it is included in this, madam.
Ma'am, Dipti ma'am.
Yeah.
In the layers of scalp, we can cover, no, ma'am, clinical significance, the black eye part.
Yes, ma'am. We can cover in scalp, ma'am. But in cranial cavity, is it relevant, ma'am? This anatomical basis of black eye.
Yeah, it is relevant, but only at one place we can cover that part. So, in relation to the scalp layers, we can cover, I think.
Yes, ma'am. So maybe we could drop
Yes, ma'am.
that.
Even I thought that in scalp we can include that.
Yes, ma'am. And also, can we have domain and level of proficiency for each SLO, because they differ? This is like domain and level of proficiency is only for the competency, but the level of proficiency will differ for each SLO. Dr. Sharmila?
Yes, madam. Madam, I feel...
one more is there before Dr. Sharmila answers. Can you use the verb give? Give the anatomical basis. That give can be used.
Yes. Yeah, because give cannot be measured. So maybe.
Okay.
Dr. Swati? Ma'am, you'd like to? You have raised your hand.
Yes, ma'am. Good evening. Good evening, everyone. No, ma'am, I had the same doubt regarding the give.
Yes, ma'am.
Yeah. I just had the same doubt regarding the give and the black eye. It is already cleared.
Dr. Sharmila, can you change the verb and use any other measurable verb?
Madam, it is actually, what is the basis?
Yeah, anatomical basis.
Anatomical basis.
Explain.
Or
you could write explain
the
anatomical
basis, madam.
It would be describe the anatomical basis of,
yes.
ma'am. It would be easy. Like it is better using the simpler action verbs, I feel.
Okay, madam.
Yes, ma'am.
Explain the anatomical basis.
Yeah, explain anatomical basis or describe anatomical basis would be better.
Okay, ma'am.
And when you write enumerate, it would be at K level, right? Proficiency would be K. When you come to describe, it would be KH. And here, this is just describe. Can we look at the competency and look at the level of proficiency? The MCI document gives SH also as a level of proficiency for this particular competency, but the domain is just K, knowledge.
Knowledge, yes, ma'am.
Yeah, so I don't know whether SH would be appropriate here, because we are not doing any skill element here, right? Everything is theoretical.
In a similar way, like when if at all they are in, like if the competency includes describe, and like I have just when I was going through all the SLOs, when the competency was described and some of them are using the draw or illustrate, there can this SH be used, ma'am? Shows how? To my understanding,
yes,
okay.
Yes, ma'am. Just one general observation that I've had so far is there has been a confusion for draw and label. The
exactly
and level of proficiency. In earlier discussions, we had discussed that it is knowledge level and the proficiency is KH, not SH. We had discussed that it would be knowledge level and it would be KH. It would not be a skill. That's what if I remember. And
yes,
and the other one is identify and demonstrate.
Exactly, ma'am.
We had already discussed it was a skill, a cognitive skill. So, MCI document has used only one level of proficiency for skill, and that is SH, and not S. Nowhere in the document for anatomy, the level of proficiency of S has been used. It is SH. So we have had this discussion earlier as well, that whether it is identify or demonstrate, it would be a cognitive skill and the level would be SH. Anyway, maybe I am not very sure of it. Two people have raised their hands. Angela, ma'am, you have raised your hand. You can unmute yourself. Ma'am, you are not audible, ma'am. There's some audio issue, I guess.
Can you hear me?
Yeah, now we can hear you.
Deepthi ma'am, can you hear me?
Now we can hear you, ma'am.
Okay, ma'am, what I wanted to add in here was that if we take this competency to the next level, because structures passing through each of the foraminae, we could demonstrate them also in this competency. So if we take it to that level, can it be used how?
Yes, ma'am.
And on that part.
Yeah, even Dr. Bhavna has opined, SH will be living anatomy. Yes, but in the MCI, this is for discussion only. The MCI document has not used level of proficiency as S anywhere. They have mentioned only K, KH and SH. So the Miller's pyramid, they have gone to only knows how, shows how and performs. Those are the levels that have been used for anatomy in the document. For physiology, I noticed for ECG, they have given skill and S level, shows. But I don't know why in anatomy document alone, it is put as SH. So Angela ma'am, as you said, maybe higher levels we can go to SH. Dr. Bhavna, I agree with you as well. Dr. Saikat, you want to say?
Ma'am, but this is an, I think, competency of osteology, isn't it?
Yes, ma'am.
Am I audible, ma'am?
Yes, sir.
Madam, I just want to say that we should not mix up the domain and the proficiency level. The domain and proficiency level are parallel to each other. So if we use domain like K or S, and when we are marking as level K, KH or SH, so SH does not stand only for the living subject as far as I know, ma'am. If I am wrong, please make me correct. So the level will depend how you are applying your knowledge or your skill. So in anatomy, you have correctly told, ma'am, that if the skill is there, then the proficiency level is the highest level, that is the SH in anatomy. But if there is a K, then it could be nose or nose out. So as you mentioned, ma'am, that SH is for the living anatomy, I think it has not been mentioned in the MCI booklet like this. Thank you, ma'am. If there is anything wrong, please make me correct.
You are absolutely right, sir. That is why when the knowledge, the domain level is knowledge, it has to be K or KH. I agree with you. That is why I mentioned when label, draw and label, it was knowledge, but shows how. I found a discrepancy there. And as you rightly pointed out, skill, when it comes to skill, like identify or demonstrate would be a cognitive skill. I don't know how many of you agree to it.
Yes, ma'am.
Anyone who does not agree to identify or demonstrate in the cadaver or the osteology part as skill, cognitive skill?
Ma'am, can I say something?
Yes, ma'am.
Ma'am, I am Dr. Shilpa.
Yes, ma'am.
Ma'am, as far as a skill, I think we'll better go, it's my opinion that it is better in the category shows how. Rather than demonstrating a structure is not a skill you are enveloping. If you are, like ma'am, as per my understanding, when we are palpating organs on a patient, that is a skill. But when we are just, picking up structures and showing, I don't think, ma'am, that comes out as a skill.
Ma'am, can I say something here?
Yes, ma'am, sure.
Dr. Swati here, ma'am. Ma'am, like I just wanted to put it, like in the previous discussions, When skills have come, we have divided it as cognitive skills and procedural skills, ma'am. Procedural skills actually we meant where there was manual dexterity. And what I feel is, though it is cognitive skills under knowledge or skills, procedural skills, each student should have the required knowledge, should have the required comprehension of it, should have the required application of it, man. So even skills would definitely include knows how. But one thing in procedural skills, the skills part of it is deemed to be considered that the student already has surpassed the knows and knows how. That is why he is going to shows and shows how. But when cognitive skills come, definitely the student initially is at the knows level, then he's knows how level, then like in that way he's stepping up the ladder above. But in procedural skills, the basic difference I feel is already is deemed to be understood that the student already has the knowledge, he knows it and he knows how. That is why he is able to show and shows how. If I I submit here.
Thank you, Swati ma'am, for your.
Here, if anybody can add it, you can add on.
Yeah, anyone else wants to add to what Swati ma'am has said?
I agree to that, ma'am, because if you have to go to the higher level, it is implied that you have to know and know. So it goes just like that only. So the other levels, it is actually what I feel is that it is implied that only if you know, then only you can show and go to shows how level.
Ma'am, Deepthi ma'am, I just
Yes.
had a thought. I just wanted to just exchange my view. What I thought regarding after going through the MCA document was, ma'am, previously also, first year, second year, the final years, it was such a way that the student is gaining knowledge in the first year, trying to apply and analyze in the second year, and then he is going for application or the higher analysis part in the final year. So what was my thinking is, it might be or might not be, it is just my perception. What I thought was, when deriving our competencies or when framing our competencies, might be the thought for the experts was only restricted for the cognitive skills, ma'am. So might be the skills part was the shows part in the Miller's pyramid, which we are thinking. The shows part was actually deficit there, or it was, I don't think so, it was purposefully missed also. Only thing they thought was cognitive skills, and the student in the first MBBS, especially anatomy, should be able to have all the perfect cognitive skills which will fulfill the knows hows and shows how. Though under cognitive skills, I feel these three categories of proficiency level, knows how and shows how, should suffice the identify part, the demonstration part, and even the drawing and the illustrating part. Others can please add on.
Thank you, ma'am, for your view.
Hope I'm clear, ma'am.
No, you're clear, ma'am. Here, you take this 26.3, it is knowledge domain, and the level of proficiency for all from number 1 to 5. How do you classify K, KH, and SH? Why I'm saying this repeatedly is that even in the competencies that have been presented today, the level of proficiency has been different, and the SLOs which have been framed is slightly different from each other. So I feel from the beginning, we have had this discussion, and finally when we make a document, there will still be discrepancies. Like if you have framed that S level, S domain, KH, okay, you have felt it is KH level, but somebody else will have put it as SH, and it will be a similar kind of a skill. And somehow I feel we are almost reached the end of the competency discussions, and we are still confused between all this. We are still, all of us, not on the same page. So that's the only reason I wanted to discuss.
Ma'am, I can say anything regarding the level.
Yes. Yeah, please go on.
Ma'am, myself, Dr. Sheetal. Ma'am, what I believe, when we are mentioning shows how level, it means automatically the students is having a K and KH level. It means, so we don't have to mention the lower level here. So shows are no higher level. If we are mentioning about the higher level, So definitely there are the lower levels are completed by the student. That is understood. So that is the point I think I should mention here.
You're right, madam.
So
Anybody
ma'am,
else
we
wants
need
to
to write
discuss
down all the
26.3
levels
or?
at the same time. Okay, just everyone has to mention only the higher level or the actual at what level he want to mean the student to be able. Actual the level that should be mentioned here only.
Yeah, exactly. And for domain of K, would you go to SH level? If you look at the Miller's pyramid, SH comes from the practical aspects, as far as I know.
It
Okay.
should be parallel to the either to the psychomotor or the affective domain. So
It
K
can be
can be,
cognitive skill level also. Cognitive
yes,
skill
it
can
can
be
be
SH.
cognitive. Yes,
Yes,
it can be
yes.
cognitive.
Ma'am, Sheetal ma'am,
Yes.
like earlier, Saikit sir also has mentioned, like in the initial discussions also, we have come across that the SLO should be in line with the competencies, and even the domain and the proficiency should be in line, madam. Again, when you say parallel again becomes another
Yes,
perception, ma'am.
it's a
So,
parallel.
so what I feel is aligning. So whatever content you are putting into your SLAs, that content should align with the competency, madam. The same should align with, that is, all of should pass in that 180 degrees trajectory, madam. 180 degree strategy. It should not be in such a way that they are parallel, 180 parallel. Hope I'm clear here. Like today I'm short of words, why I have no idea. But what I feel is aligning. What I feel is when you are dealing with proficiency levels, I feel is personally you should look at your specific learning objective and see to the content of the specific learning objective and decide whether it is knows how, or shows how, madam. So it might be MCI document has given freedom to the faculty who are framing the SLOs that in few of the competency it has provided K or bar S, and it has provided 4 options of proficiency for us. So what I feel is the type, depending upon the type of framing we are doing, we can categorize them into different proficiency levels depending upon what we want to extract from the student at the end of the session. So definitely when we go to the next set, that is when we are aligning the assessment also, what we feel is this content point of it should be more highlighted, I feel, ma'am. Thank you, ma'am.
Okay, ma'am. Thank you, ma'am. Let's move on to the next competency.
Dipti ma'am,
Yeah,
I think
please
Dr.
go on.
Divya, Dr. Saikat, Dr. Prerana have raised their hands.
Okay. Well, ma'am, will you unmute them according to order?
Ma'am, I think they can unmute.
Yeah, ma'am, I'm.
Muted.
Yeah, please speak.
Yeah, I'm Divya. Ma'am, there is a query, ma'am. The thing is, the proficiency levels knows how, shows how, performs all addresses for a competency, no, ma'am. The Indian medical graduate, at the end of a thing, he should be competent enough to perform that. So, how can you fix a proficiency level for an SLO, ma'am? So it was actually already discussed in the previous session, but I feel that, so please, yes, ma'am.
Yeah, just my opinion on it. When you take any one topic, like describe the cranial cavity here. So you're going from the lower level, enumerate what are the bones, and then go up to higher level of explaining clinical anatomical basis of a clinical condition. So there itself you go from K onwards upwards. And here I really do not know why SH has been mentioned if the competency is only theoretical, describe. One of them, actually, Dr. Divya, you yourself pointed out, I guess, or was it?
Yeah,
Dr.
yeah, yeah, ma'am. That's the second query. Yeah, ma'am. Yeah.
26.3, 30.1, and 30.2. All of them have cranial cavity as the
Yeah, ma'am.
competency. So I feel at one point it is osteology, and the other one, maybe 26.3 is osteology, but 30.1 and 30.2 are related to soft tissue. You know, cranial cavity with folds of dura mater. You know, or so maybe those SLOs can be framed there. While here we can restrict to just bones. While there you can go to soft tissue as well. That's what I felt there was a difference in the, so there you can, there you can go to, this is osteology, right? I feel the competency itself should have been demonstrate also, describe and demonstrate. Again, your opinion. Why in skull osteology there is no demonstration of foramina and structures passing through them? That,
ma'am, I think
Ma'am,
of structures passing through them in both osteology as well
yeah,
as
ma'am.
yeah, in both, but should they not be demonstrate for skull osteology? Okay, there are lots of people.
Ma'am, it's given in the other competencies, ma'am. It's given.
Yes, yes, ma'am, I understand that's soft tissue, right? But this is skull osteology.
Yeah, yes.
Okay, Dr. Prerna, would you like to share your views? We'll see what Dr. Prerna wants to say.
Yeah, ma'am. Can you hear me?
Yes.
Okay, ma'am, I just want to clarify. Is this level of the competency K, KH and SH written in the MCI document?
Yes, it is.
Ma'am, if it is given over there, then we have to consider it because we have to go by the document only. So if it is mentioned that SH is there, then that means they want us to go up to SH level. Like we cannot just mold this MCI document. This is what we in our college and the discussion, whatever has taken place in our different trainings and all. So this is what we have decided, or we have been told, that MCI document is a certified document. We cannot just counter it. We have to just change our perceptive according to whatever is written over there. So if they have given SH with knowledge domain, then that means they want us to include this SH part, as Swati ma'am has, like, I think Swati ma'am has very logically put it, that if we draw or if we are adding demonstrate, like we can do it. If they have given SS, then we can do it. We can just say that we draw and show these things, or demonstrate or show the different structures passing through the different foramina. Then it will go to SH level. As Dr. Shoikat also mentioned, we have been told this thing in our training. I'm just returning from my CISP training. So there also they told us, like, for knowledge domain, we can have knowledge, knows how, shows how, and for skill domain also we can have K, KH, SH. So we have to just go by the document. We cannot just alter it. This is what
Madam,
I understood.
Okay.
Madam, here it is Dr. Shoikat. Just adding to Dr. Prerna, that competency level AN 26.3, it has been given in the MCI document. The domain is not only K, it is K/S, and the proficiency level is SH. That means when we are forming the SLO, we should take care that we have to form such SLO where the knowledge and also the skill, that may be cognitive skill, that may be psychomotor skill, could be judged or could be discussed to the students. That's why it has been given in the MCI document. The domain is K/S. That means we have to form that kind of SLO which will touch the knowledge and also the cognitive skill domain. And already it has been discussed, whenever we are touching the skill domain, then the proficiency level could be up to SH in this first year student. There is no chance of performance. So up to SH it has been given. The highest level which could be attained at this period is SH as described by the MCI document. So during the formation, I think there should be one more SLO, one or two more SLO where Madam could add as the identify or demonstrate the foramen in the base of the skull or in the front of the skull, like that, to fulfill the K and S domain of that particular AN 26.3 which has been given in the MCI document. Thank you.
Thank you, Dr. Saikat. You're right, sir. It is K/S actually, knowledge or skill domain. And I think the competency should have been describe and demonstrate or describe and identify. I feel the competent,
Madam,
competency could
if
have
we
been
want
altered.
to describe, ma'am, we definitely have to identify also. Otherwise, we
Okay,
can't.
sir.
That's that.
Hello,
Okay,
ma'am.
sir.
Hello,
Okay,
ma'am.
sir. Yes, yes, Dr. Sarla.
Ma'am, good evening, ma'am.
Good
Ma'am,
evening.
even at first I thought it should be like describe and demonstrate. But when I went through repeatedly, I understood it's an osteology. So what I thought, demonstrate the structures passing through them cannot be appropriate. Hello?
Okay.
Hello?
Identify, no?
Yes, identify. We cannot mention, no, ma'am, because it is
Yeah.
in the bone.
Yeah,
So we
name the
cannot,
structures passing through. Yeah, right.
that cannot be done. So I thought maybe because of that reason, that word would have been not mentioned here. And when you come to the domain level, and that I mean, it is, as sir said, it is shows, I mean, skill also mentioned. And coming to the teaching learning method, it is DOAP is mentioned in MCA document, I'm saying, ma'am.
Yeah.
And also skill assessment. So what I understood, it is indirectly, I mean, it is understood that the skill, I mean, shows how is an appropriate level of proficiency. So that our SLO also should include identify as well as demonstrate of the phenomena as well as the I mean subdivisions and the phenomena of the cranial cavity. That's what I understood.
Okay,
Yeah,
but
ma'am. We have to add
SLOs are identify,
foramina.
right? Yeah, identify, right? So
Yes,
Of the
ma'am.
that's
foramina.
the
It should
reason.
be included.
Yeah,
Yes,
why they have not included? The reason I feel Dr. Divya can answer better. No, Sharbila can answer better. Why they have not included identify? I feel because in the competency it wasn't there. They have not included that. That's what I felt. You know, in
Ma'am, but the
competencies.
assessment it is mentioned, no, ma'am. Skill assessment, and
right.
even the TL method is DOAP.
Yes, yes.
It is
Yes,
understood
okay.
that we need to go for identify or demonstration.
Okay, so we need not focus too much on the competency, whether demonstrate or identify are given. Point taken.
Yes, ma'am.
Okay. Shall we move on? Thank you everyone for the great
you,
discussions on the first competency. Next, we'll move on to the next competency. Group C is to review it. Dr. Saujanya, will you be sharing your screen?
Ma'am, please share, ma'am.
Okay. This is your competency, right? 27.1.
Yeah, ma'am, 27.1. Scalp.
C, Group C, anybody would like to review? If not Group C, anybody else would like to review it? Dr. Sarla?
Hello, ma'am.
Yeah.
Ma'am, this is regarding the SLO, ma'am. Is it okay to use a common verb for all the SLOs?
Yeah, exactly. At the end of the session, phase 1 student should be able to know. Dr. Saujanya, I think you can modify it. It should be able to, and then no should not come in the stem.
Okay.
Define skull, and then mention the extent of the scalp.
Yes.
Okay.
Describe the different layers of scalp and their composition. Yeah, Dr. Sarla.
Because the 3rd, 7th, and 8th SLOs, they need much higher level of proficiency, like discuss or explain something like that. So I think it is better to use verb for separately for each SLO. That is what I feel, ma'am.
Yes, I agree as well. So Dr. Saujanya, if you drop that word no on top of the stem,
yes,
then you can change all the verbs to define the scalp, mention the extent, discuss or describe the different layers of scalp and their composition, explain the arterial supply,
venous drainage,
and explain the surgical importance of the layers. Okay.
Okay, ma'am.
Ma'am, better to follow the forum criteria discussed in the previous session, madam. Like this is all just a simple short. So just a simple advice, follow the forum criteria.
Yes. Dr. Saunjanya?
Yes, ma'am.
I think you got it, right?
Yeah, ma'am, I got it.
Dr.
the
Bhavna?
methods also?
Yeah, Sheila ma'am?
What about the teaching learning methods? They have just most of them are just mentioning a practical and lecture. Why don't we think about some innovative methods also? Why don't we include those other teaching learning methods?
Yes, ma'am, please suggest.
Ma'am, in this particular
Because
case,
especially lecture, we should never write lecture is my opinion. We should always write it as interactive lecture. Don't make it a didactic lecture nowadays. I don't advise, I mean, going for a plain lecture class. It should be an interactive session. And we can, I mean, think about some other methods also when I'm generally talking, because whenever I saw all these things, everywhere we have just like, so I felt that we are just copying from the MCI booklet. If we can have some suggestions of any other methods of teaching learning also, we can suggest. That is my opinion.
Okay, ma'am. Dr. Saujanya?
In this practical session also, they have written it as define, scalp, extend. They have just combined it everything together with that verb. And in practical session, I don't know how far we will be able to differentiate all the layers of the scalp and show all these structures. So does it gel with the SLOs, the teaching learning method? Generally, they have just put it as practical and lecture together.
That is for just showing the extent, ma'am. Extent we can show in a small group discussion in practical, and arterial supply and venous drainage also, but not the layers. Actually, we cannot separate the layers.
All these you have just put all the single teaching learning method together as practical and lecture together.
Yeah, ma'am, we can separate it, no problem.
That is what so where we can show, because the SLOs are there where the surgical importance of layer, clinical correlation, so it would be better that we take out which all competencies we will be dealing in a lecture class and which all SLOs we will be dealing in a practical sessions separately. If it is there, it would be better. That is my suggestion.
Okay, ma'am.
And the verbs used also, I think, like just now what we discussed, arterial supply, venous drainage, nerve supply, we need not break it down so many SLOs. We can even make a single verb for all these things together. Is it okay? I don't know. I felt so.
Yes, ma'am. Describe the blood supply of scalp, including arterial supply and venous drainage. Can be one.
At least split the SLOs which will go along for a lecture class and make it that together, and which would be for a practical session, make it separately.
Yes, you're right. Dr. Bhavna or Dr. Vaishali, would you all like to share?
Am I audible, ma'am?
Yeah, Dr. Bhavna. Yes.
Yeah, ma'am, just one or two things. The SLO number 7 and 8, the one is surgical importance, other is clinical correlation. So rather than these, I thought we should ask these students for anatomical basis of applied aspects of layers of scalp. That will be more towards the phase 1 students. Then even for venous drainage or arterial supply, madam, we can ask for at least one applied aspects of these parts of scalp. Like arterial supply with its applied, venous drainage with its applied. We have applied lots of applied aspects in scalp, ma'am. I was thinking that maybe this topic can be taken as a SDL topic also, and also maybe with its applied parts, we can go for a basic ECE, a classroom ECE. Is that what does everyone say? I thought it's a good topic for understanding.
Instead of just a lecture class, we can include, that is what, there comes the importance of just dividing the SLOs according to the knowledge and the level, and so that we can plan a teaching learning session for a lecture class, or if it is a case-based learning we want, which all SLOs will go into a case-based learning. So in that way, we can divide the SLOs a little bit more with clarity, so that which all SLOs we will be combining for a case-based learning, if we want, or if which all SLOs we can just take it as an interactive lecture class. So such things, I think a little bit more clarity would be nice when you put the SLOs showing the domains and levels, and which all can be combined as a lecture class, instead of putting it just like this, all the SLOs 1, 2, 3 and writing just practical and lecture.
Dr. Saujanya, I think
Yes, ma'am.
you can modify that into EC where you want to bring in case-based lecture and so on. And as Sheila ma'am has discussed, and as Dr. Bhavna mentioned, that clinical correlation that you have put number 8, you can make it more specific, clinical importance of each layer of the skull, since she mentioned that.
Okay.
You can just modify it that way.
Ma'am, I have a question here.
Yes. Yes.
Ma'am, like we just said that instead of lecture, we should be putting it as a interactive lecture. It's just a journal query that in that 1 hour, will we have time for interactions?
I don't think there should be a problem. Interaction is, you can put 5 MCQs in between each layer of the scalp. You put an MCQ and then ask them the answers. I don't think it would be. I think it's interactive lectures would be more engaging for the students, wouldn't it?
Yes, ma'am.
Okay, ma'am.
Anybody else wants to discuss this, or shall we move on to the next? I think we'll move on to the next. We'll move on to 29.1, Dr. Saujanya. Okay, group C.
Yes, ma'am, 29.1.
Yeah, right. I'm just moving it. Group C. Or anybody else would like to review 29.1?
Ma'am,
Again,
steps of dissection to display the muscle, is that important for the MBBS teaching them the dissection?
Oh, yeah, that's true.
Ma'am, again the same. Can I say something?
SLOs. Yes.
Dr.
Please.
Dipti?
Yes, please go on.
Yeah. Again, the same thing is there. We do not have proper action verbs used because this is a K/S domain. So we need to have very clear action verbs for the SLOs. And based on that, we are going to definitely, as Dr. Sheila said, we are going to align the teaching learning methods. So this again is a case, similar case to the previous one, that the SLOs are not clearly defined.
Can I add one more point to it?
Yes, please go on.
The competency should have been divided into sub-competencies because the competency involved describe and demonstrate. So theoretical and practical sessions should be separated, and the action verbs, say for example, it says SLO at the end of the session. The first year student, the first year we are not using this terminology. We are using phase 1 MBBS student. Then again, the action verbs are not present in the SLOs. They are able to, then is location of sternocleidomastoid muscle. Something is missing in between the beginning and the thing which the teacher wants to teach or which the teacher wants to ask. And similarly, the teaching learning methods have not been used properly.
Dr. Saujanya, it's the same thing that Dr. Sheila also mentioned earlier. Punita ma'am also mentioned earlier.
Okay, ma'am.
You can modify it into, at the end of the session, the phase 1
students,
MBBS student should be able to locate the sternocleidomastoid. That becomes a skill domain, right?
Yeah,
so
ma'am.
there you get practical teaching learning method.
Yeah, ma'am.
Then should be able to mention origin and insertion of the muscle, describe the nerve supply. Action you can make separately, and it just demonstrates sternocleidomastoid, right? So identify the sternocleidomastoid also. You could add one, okay? And steps of dissection, like they mentioned, I think we can drop that.
Okay, ma'am.
Steps of
Ma'am,
dissection.
in that case, we can use testing of muscles
Yes,
because
ma'am.
this is a sternocleidomastoid is again very important for muscle testing.
So
Ma'am,
that
but
should
there
be
is
also
another
added.
competency, I think. There is another competency for
Okay.
testing muscles.
Ma'am, that is
Okay.
completely different. No, it's given separately. But I think even here it could be added. No harm in adding demonstrate action of sternocleidomastoid. Probably. In
Demonstrating
a
actions and testing of the muscles, these are two different things. So action
yeah,
can be added over here.
right, right. You can add.
Ma'am?
Yes, Dr.
Hello?
Sarla. Yeah, Dr. Sarla.
Ma'am, yes, other persons, faculty mentioned action verb is missing in this one. And
Yeah.
this fourth SLO, is it necessary to mention in different areas? I don't understand what does it mean.
Yeah,
So it means upper one third,
Upper,
middle
yeah.
one third, lower
Ah,
one
right.
third.
Lower one third. That
Maybe
was
that
Is
could
it
be specifically mentioned then.
Yes, that areas I don't be convinced, ma'am. That
Yeah, Dr. Saujanya, you could, as you specifically mentioned, you can mention superficial and deep relations in the upper one third, middle one third, and lower one third.
Yes, ma'am.
and the last SLO, ma'am, steps of dissection. Is it? Can we reframe this SLO, or is it correct, ma'am? Because for demonstrating the sternocleidomastoid, steps of dissection, is it required?
No, that we just discussed that they can drop that SLO.
Yes,
Actually.
ma'am. Okay, okay. That's it, madam. And
Anybody else?
regarding,
Yeah, tell
yes, ma'am.
Dr.
No,
Sarla.
no, this TL method already madam has spoken about it. It should
Yeah.
be separated
Yeah.
depending upon SLO. Yes, thank you.
Dr. Deepti, before
Yes,
you go
ma'am.
for the next one, I just
Yes,
want
ma'am.
to say that these two competencies that we reviewed right now, though they were not framed properly, I think they have given us a very good answer to framing the SLOs properly. Actually, I would say it was a blessing in disguise that they were not framed properly, because we could come out with how to frame them in a better way. So still, I would say that it's a good way that they made these competences and we could find out the discrepancies and where they should be corrected in a positive way. I would say it was good.
Absolutely,
Thank you,
ma'am.
ma'am. Yeah.
Dr. Saujanya, you've actually broken down, the sub-competencies very well, actually. Only the action verbs were not used. Otherwise, the objectives were right. Only the action verbs were not used.
Okay, ma'am.
Dr. Rajeshri, ma'am, you can unmute yourself.
Yes, ma'am. Good evening. Ma'am, can we keep one SLO as demonstrate the attachment of the sternocleidomastoid on the bones or the articulated skeleton?
We can do that also, ma'am, because demonstrate attachment C is given. Yes, ma'am. We can have that as an essay.
Okay.
Dr. Saujanya, you can note that down.
Yes, ma'am.
Yes. Anybody else with opinions, or shall we move on to the next one? The next one, thank you, Dr. Saujanya. And Dr. Mahima.
Ma'am, can
Will
you
you
able
be
to
sharing?
Yes, ma'am, I'll share, ma'am.
Then I'll stop sharing this.
Yes, ma'am. Ma'am, can you able to see?
Yes.
Yes, ma'am.
Yeah. Group F, anybody wants to review?
Yes, ma'am. Good evening, everyone. I'm Dr. Deepalaja from Group F1.
Yes.
Am I audible?
Yes, you are.
Okay, ma'am. Actually, first of all, I want to say all the SLOs are very nicely framed, but I have only one query that we can break all this SLO again, like 28.3.1. We can break it again, or we should continue in this one SLO only.
Okay, there are two participants who have raised their hands. You can, Rajeshri ma'am, you can unmute yourself.
Ma'am, I'm already, that was the earlier I raised my hand.
Okay, okay. Okay, ma'am. Dr. Mahima, would you like to respond? Or anybody else wants to respond to it? Yes?
Ma'am, I think this SLO is better more than breaking up, ma'am. Actually, describe the origin, everything will we can put in one SLO itself, ma'am. Because if we put so many SLOs means SL, it will be more, no, ma'am. So only we thought of putting as a single SLO.
Okay, there are two people who have raised their hands, Dr. Sarla and Dr. Sheetal. You all can discuss one
Hello,
at a
ma'am.
time.
Ma'am,
Yeah.
when the action verb used for this, for separating these each one, if it is going to be a same, then in that case we can combine all together and do.
Okay. Dr. Sheetal?
Ma'am, as far as the SLO are concerned, we should remember the smart thing, which is that it should be measurable, it should be all the characteristic of should be there. But here it is there, but it is having a multiple small, it looks like a combination of multiple small SLOs. But SLO should not be like that. It should be a separate one. So here it looks like a competency rather than an OSLO. So it should be a separate.
Okay, ma'am. Okay, okay.
Okay, anybody else has any other view regarding this?
Ma'am, Dr. Deepti?
Yes, ma'am. Yes,
One
ma'am.
more thing, which as we are going through the competencies, one more thing I want to pinpoint is domain for SLOs is mentioned. First is domain for the competency, whether it is knowledge or skill, right? And then for each SLO you mention whether you are targeting a knowledge domain or a skill. That is when you demonstrate it becomes skill. But another thing is, I have seen that we are writing in competency level 2 or 3 levels. It should only up to the last level, whether it is KH or whether it is S or whether it is SH. We shouldn't be writing K/KH or SH because we want to reach a particular level. And if you look at the MCA document, they have also mentioned only one level for the competency. The level which I've mentioned in above, that is in the table above, is just showing you whether we have to reach the K level, KH or SH. But I am seeing that most of us are writing in the level 2 or 3 levels. Do you agree with this? Because it should be up to what level you want to achieve this SLO.
Agreed,
Am I clear?
Agreed,
Am I clear?
Yes, ma'am. Yes, ma'am.
Yeah, because when you write KH/S, your final level is S. Definitely KH will be achieved. So you need not write KH. It has to be only S. Again, the same which you mentioned in the beginning, S is not there in the document. So we cannot write S anywhere as a level. It will be either K, either KH or SH.
Yes, ma'am. I
Else?
agree to that, ma'am.
Because I think we need to rectify this because it is a recurring problem. We are going through the same things again and again. So we need to pinpoint this very clearly.
Yes, ma'am.
Anybody else wants to add into that?
Dr. Shanti, you have raised your hand.
Yes, ma'am. I too agree with madam, ma'am, because since making the bars again and again, this or that will be confusing. So we have to stick to that one point. Whether if it is knowledge domain, then we can go to the higher to reach the higher level. Knows how. The same way for psycho domain or skills, whatever it is, we can go up to shows how level. And regarding the splitting up of specific learning objectives, ma'am, actually when we use one particular verb to show that objective, like able to define the origin or able to describe the origin of an artery, whatever it is. Initially when we put separately, and there are few members suggested it can be combined. So I think that is the reason they have combined. We have combined here. So this also it can be mentioned, stated clearly whether it have to split the SLOs like for each objective with a appropriate verb, or we can combine 2 or 3 subparts for that specific objectives.
Right, Dr. Shanti, as Dr. Angela has mentioned, there seem to be two schools of thought amongst all of us. One group believes that all the objectives can be clubbed together, and there is a school of thought that they should not be clubbed together. I personally feel, as you feel, Dr. Shanti, it is a specific learning objective. So each objective should have its own verb. And Dr. Bhavna also agrees, she has put in the chat box. How do you assess if you do not have the proper, verb for each of the objective? How do you assess it? So
Yes,
those
ma'am.
of us who believe that for assessment it is important, we'll always split the SLOs. And I guess there will be a group of people who would like to club all of them together. Anybody else has views regarding this?
Ma'am, even if we club the SLOs together, it should be, perspective should be clear not only to the teachers and the assessors, but also to the students. That's very important.
Absolutely.
Because we see that students may, all of us face these problems. Students come to us intermittently, what I'm supposed to read in this topic. I think that time, why do they ask us is because we are not clear about SLOs. We don't project them properly to them and they are confused. Now, what should we read in this topic? We all must have come across this query many a times. So therefore, I think this splitting of SLOs makes us also clear, and we can also project to the students very clearly what is, like when we say that a draw and label is there in the SLO, this means the students are very clear. They need not ask again and again, what topic should I read for draw and label? They're very clear it is in a SLO. So it has to be done. I think this will again make it more clear that why the splitting of SLO is important.
Right, ma'am.
Right?
You're right.
Thank you, ma'am.
To align the assessor, student, and the teacher, it is a good point that you have put, ma'am.
Yes, ma'am. Can I add? I feel
Yes,
that if
ma'am.
the verb is the same as well as the level and domains are same, we can club. But when the level changes, I think we need more SLOs for that, because here applied anatomy, it is just put just like that. So might be applied aspects, it goes to a higher level. So if we have, we can split that into another SLO, it would be better, because this has been clubbed, everything has been clubbed together. All the levels, everything, it's a mix up. So
Yes, ma'am.
especially when there are different levels of proficiency levels, I think better we have separate SLOs.
Yes, ma'am. Praveen sir, you have raised your hand. Please unmute yourself, sir.
Yeah. Actually, I just joined in, and the point of splitting the SLOs I was just listening to. So I think the reason why we need to split the SLO again is try and look at the forum criteria for every SLO. Like, for example, if you look at this SLO 28.3.1, which talks about origin, cause, relations, etc., etc., and finally applied anatomy of facial artery in the face. When we write such an SLO, describe applied anatomy of a particular structure, it still may not be unequivocal. When we say applied anatomy, there are a lot of things that can be there in an applied anatomy. So even that applied anatomy aspect can be split. Anatomical basis of A, B, C, D, if we write, there's no harm in writing that way, because it becomes absolutely clear what is expected out of a student to learn and what the teacher has to teach. So it becomes very easy, and simultaneously that is going to help us in assessment also.
Yes, sir. Thank you, sir.
Thank you.
Shall we move on to the next SLO?
Hello,
next competency. Yeah, Dr. Selva.
Ma'am, screen has disappeared, ma'am.
Yes, ma'am. Yes, ma'am.
Can you please share it
Yes,
again,
ma'am.
Dr. Manima?
Yes, ma'am. Sure. Ma'am, can you able to see?
Yes.
Yes, ma'am. Yeah, yes, ma'am.
Yeah.
Ma'am, in the first SLO, describe the origin. It has mentioned, no? Is
Yes.
it right to include the word in face? Will it be appropriate? Origin and in face. Is it okay?
Describe the origin
Cause,
in face.
relation.
Why? Because the competency is describe the and demonstrate origin, formation, course of facial vessels.
Well,
They're
yes,
not
ma'am.
mentioned in the face, right?
Yes,
Yeah,
yes,
right.
that is what.
Actually, the
Because we
topic is
cannot
face
combine,
and
ma'am.
parotid region, so only we have put as facial artery in face actually. The topic is face and parotid
Yes,
region.
ma'am. Yeah, yes, ma'am.
The origin is in, right.
Origin is in neck actually.
Yeah,
But,
that's why.
since
So
the
I
topic
think it is better to remove in face, ma'am. That is what I feel.
okay. Sure. Thank you.
Yes, ma'am. Yes, that's it. Thank you, ma'am.
Okay. Thank you.
And ma'am, and one more thing.
Yeah.
Ma'am, the domain is skill also mentioned in MCA document for demonstration. So can be included in this. It is mentioned as K only.
K and KS, yeah. K
yes,
slash S is mentioned.
Yes. And
So
the
again,
level is KSH, ma'am.
Yeah, right. And yes, the letter S is not used. Show is not used in anatomy part, because in physiology they have used S, but in anatomy it is only shows how level somehow. So I think you can take that into consideration, Dr. Mahima.
Okay, ma'am. Sure, ma'am. Sure, ma'am.
And skills also have been mentioned in the MCI document. So please take care of that as well. Dr. Sheetal, you want to
Yes,
say something?
ma'am. Here we are talking about the skill. So I just would like to mention कि in the MCI document, as far as the anatomy subjects is concerned, there are only two type of skills that we should certify. That is the given only two skills, certifiable skill.
Yes.
These are of histology skills. So as far as this is my knowledge about the skill certification. That is what I would like to mention here only.
Okay, those
One more thing I would like to say, the SLO is not mentioning the audience. The usual thing which you used to say at the end of the session, the phase 1 MBBS student should be able to.
Dr.
It should
Mahima,
not
you
be
can
so
write a
much.
stem. Yeah, you
Yes,
can
ma'am.
write a
Yes,
stem
ma'am.
for that.
Sure, ma'am. Okay, sure.
Shall we move on to the next one?
Ma'am, can I just say something?
Yeah, yes, ma'am.
Ma'am, I'm just talking about 28.3.6, demonstrate the surface marking of facial artery. Isn't there a separate competency for this?
Demonstrate surface marking of facial artery. I think even here they can put no, ma'am. There's no harm in putting demonstrate surface marking of facial artery.
Okay, ma'am.
And would that come, okay, fine. Would that come under knowledge alone?
No, I think that skill would also come there.
Yeah. Dr. Bhavna also agrees with you that surface marking is a separate demo.
Yes, ma'am. So there'll be again a repetition here. There'll be a repetition here.
Yeah.
I would like to say something.
Okay, ma'am. Yes, ma'am.
If we add surface marking to this one, then we have to arrange two different sessions. Like in the same session, we cannot do both of the things. So
Right.
why to add it over here?
Yeah, okay.
Okay.
Okay, Dr. Mahima, you can take care of it because all of them agree that there is a separate competency for surface marking. So you
Okay,
could
ma'am.
pick it there. Okay.
Okay, ma'am. Sure, ma'am. Can I stop
Shall we
sharing,
move
ma'am?
on to the next one?
Can I stop sharing, ma'am?
Yes, yes. Dr. Divya, will you be sharing your slides screen?
Yeah, ma'am. I will be doing it, ma'am.
Yeah. Group I is supposed to review it.
Okay, ma'am. Small problem. Can you please share the screen, ma'am?
Yeah, okay.
Yeah, you do it, ma'am.
.1, right?
Yeah, yes, ma'am.
Anybody from group I would like to review, or anybody else? I think Dr. Divya has already mentioned that 26.3, 30.1 and 30.2 are the same similar competencies, and SLOs also have been framed similarly. Anybody wants to discuss regarding that?
Hello, ma'am. Can you hear me?
Yes.
Dr. Bhavna here.
Yes, Dr. Bhavna.
Here, I think related structures and actually even structures passing through foramina can be done here. Identification, because with the cranial cavity open after the brain removal. Next is, I think, dura mater and all is asked in the next competency. So I think here that they face problem there in the 26.3, that how to identify, because structures actually cannot be seen with the skull. But here I think cranial nerves passing, the arteries, So we can add actually identify structures passing through foramina of cranial fossa.
Yeah, shall I answer, ma'am? Yeah, ma'am, 30.2 competency addresses that, ma'am. That is describe the foramina, major foramina, and identify the structures passing through the foramina as 30.2, ma'am. That's why we didn't include it here.
No problem, no problem. Very good.
But 26.3 also says foramina and structures passing through them. But then it says describe.
So
Yeah,
maybe
ma'am.
enumerate, ma'am. Only enumerate. But
Yeah, but then the domain given is K/S and level as SH, 26.3.
Ma'am,
Yeah,
can I add in that osteology, I think we can give it as identifying the foramina in the bone or in the skull.
Yes,
and identifying the structures passing through that can be given in this competency where it is a wet specimen what we intend to. So
Okay,
what
but,
I would say that identify the structures related to each cranial fossa, or the even we in the next one which we said that there are competency of the structures passing through the foramina, there we can mention the condition as in a wet specimen also, and that is identify the structures passing through the foramina in a wet specimen. Whereas in the osteology part, we can mention it as identifying the foramina in a what a bone or something like that. We can give the condition can be mentioned is what I feel. So it can be differentiated.
Absolutely right, ma'am. Dr. Saikar?
Yes, ma'am. Just want to know one thing, that can we put K/S in the domain of competency number 30.1.4?
Yeah, sir. Yeah, sir, I would like to address this. So the thing is, for identifying the structures related to each cranial fossa, you should have the inherent knowledge of knowing the structures, then we can identify. So the domain's knowledge and skill both comes under that objective, I felt. So that's the thing there.
But madam, without knowing, skill cannot be achieved. Could it be cognitive? Could it be psychomotor? So is it really to mention both, or should we mention only S over there in the domain?
So I think it would be better mentioning S alone.
Yeah,
But
because 30.1.3 says describe the structures.
Describe,
So
yeah.
already you have taken care of the knowledge domain there. So this could be S and then SH.
Yeah, ma'am, I have mentioned both because I have a query here, as you have already said, the cognitive skill and the psychomotor skill. So that's the reason I put both K bar S here, ma'am. So I don't think S should come there, keeping cognitive skill in mind. So there K should have come under domain, and for proficiency it should be SH, no, ma'am.
I think Dr. Saikat and myself agree it should be S and SH.
Okay.
Yes, only I think, because identify is under the SLO of cognitive skill. We are doing here cognitive skill. We are not doing the psychomotor skill.
Okay,
so,
sir. Fine.
Better, I think, ma'am, that it should be S only.
Okay, sir. Fine. We'll do it.
Yeah. Okay. Next, shall we see 31.4? Anyone would like? Praveen sir, you have raised your hand.
Yeah, I wanted to have a comment on the previous one, 30.4, 1.4.
Yes,
yeah, if we look at, can you just scroll for
yes,
and
yes.
So if you look at the construction of this particular SLOs, for example, even 30.1.3 and 30.1.4, describe the structures related to each cranial fossa. So this is something similar to describe structures related as a competency. So it will be very open. So at least I think we should try and narrow the SLOs down. This is very, very broad. Same way for 30.1.4, identify the structures related to each cranial fossa. So which means we in this SLO, we are wanting primarily describe all the structures related to anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Same way, identify all the structures related to anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Now, in that all, naturally, all means it's a vast thing. So, can we narrow it down further or break it down further? It will be probably even more specific.
Agreed, sir. Shall we move on to 31.4? Any discussion on 31.4?
Ma'am, can we have enumerate as well as neat and label diagram together, because this means there are two different SLOs. Enumerating the components and drawing a diagram, these are two different SLOs.
Exactly, ma'am. The other day, again, Dr. Praveen had asked, competency is just enumerate. So do we have to describe all the parts, anatomical features, blood supply, nerve supply of lacrimal gland, explain innervations and so on? Or the competency itself is an SLO? How do we take it? Anybody has an opinion? Praveen sir?
Ma'am, in that case, we will have to only just enumerate and stop that topic and
Yeah, that's what,
not to go into the details of that topic.
Yeah, probably the experts have felt we don't have to, the first phase student does not have to learn in detail about the lacrimal apparatus. So they've just said enumerate components.
Yes.
Yeah. So should we stick to that? Swati ma'am, you have some? Swati ma'am?
We are in the habit of doing all these descriptions, so
yes,
should we change? That's the question.
Ma'am?
Yes.
Yes,
ma'am.
But in the NCI document, the level is knowledge, but the proficiency is given as KH. But enumerate, will it be KH or it will be K?
K, ma'am. It will be K.
But in the MCI document, it is given enumerate the parts of the lacrimal apparatus, but domain is K, but the proficiency is given as KH. So
that is why I believe the document is a live document and a living document, and we can make changes. It's not like written in stone. I still feel that way. Dr.
Yes,
Prerna,
ma'am.
you have raised your hand. Yeah, Dr. Prerna. Or Swati ma'am, who is Prerna? Yeah, please go on.
Yeah, ma'am, I would again like to say, whenever in doubt, we should MCI document. So if they are saying enumerate, then I think we should stick to this enumerate thing.
Yeah, that's why Rajeshri ma'am is pointing out the level is given as KH. Enumerate is just recall, right? So it should have been at K level.
Ma'am.
So where, yeah. Yes, ma'am. Swati.
Yeah. Ma'am, like one thing I just wanted to point out for this group, ma'am, in the teaching learning methods, they have mentioned flipped classroom with PPT in learning management system, ma'am. Like this is a good point they have mentioned here. Flipped classroom with PPT in LMS or videos or problem-based learning. Like competency appears to be a smaller or a minor one where it is only enumerate part. But the teaching learning methods, like earlier Sheila madam, I suppose she was discussing regarding teaching learning method, different types of method. So I would appreciate this group regarding the methods they have put up here, ma'am. They are quite innovative. Flipped classroom with PPT in the LMS, videos, and problem-based learning. This is quite good, ma'am. We can appreciate
this TLM, this TLM we can adopt for other classes, other competencies actually.
Yes, ma'am. Yes.
Ma'am, it is my group.
Yes, ma'am. So we can adopt these teaching learning methods for other competencies. But here, if the competencies just enumerate components, we need to have a discussion on that. Dr. Bhavna, you've raised your hand.
Madam,
Yes, ma'am.
Okay.
Ma'am, like I was thinking, like some of the things, even though details of description of parts and anatomical features, blood supply may not be needed. Nerve supply, like parasympathetic supply of the lacrimal gland, we do teach and we do expect from phase 1 students. So maybe we can be little more specific what is expected other than enumerate here. But we only enumerating parts will not be enough, ma'am. Like I feel there should be more things also. Like they should know parts, because with levator palpebrae superioris, we teach them the superficial and deep parts of the gland. Or the parasympathetic supply, we always teach and we expect from them in the exams also.
Yeah, right. Now I'm wondering whether we should go by the competencies that have been laid down by MCI, or we need to reframe the competencies themselves. Because if it says enumerate, it does not mean you describe the lacrimal gland or give the secretomotor nerve supply of lacrimal gland actually. So anyway, we can keep this in mind. We'll note down 31.4 for later discussion as well.
Definitely, ma'am.
Yeah, there are lots of people who have raised their hands for this. Dr. Saikat, Praveen sir.
Ma'am.
Yes.
Ma'am, we cannot change the competencies, but I think what we can, if there is a way we can communicate with the group who has designed the competencies, we can just put to their bring to their notice
Prerna,
that
your voice
this is
is
where
not
we are
clear.
having a discrepancy. So either they will explain to us what we want to. Yeah,
Dr.
either they
Prerna
will
got
explain
it.
to us what we are trying to
you are talking
say
about the
over here,
expert
or
groups.
they will
Yes.
correct it if needed. On our own, we on our level cannot change it.
Exactly. It is just that all this we have to keep in mind, and then whether we can put it forward to the expert group. Dr. Praveen will be able to guide us better. Praveen sir?
I think, see, there's another way of looking at things. All the time we are saying that we teach these things to the students, we expect these things from the students in the exam. The other way of looking at it is, now that we have got a clear-cut document which mentions the competencies that the students are expected to attain while learning the subject of anatomy, then if that is listed as such, we have to think that we have to teach that much. That is what is expected from the students. So therefore, we have to ingrain in our mind probably that we have to teach the students only this much, and we cannot expect the students to learn more. If they learn more, that is on their own, but we cannot expect the students to achieve beyond a level of competency that is mentioned and assess that also. So we have to probably scale it down based on the competencies listed in the document, because finally the competency document of the subjects has been worked keeping in mind the exit competencies. That is what we have to assume, and that is the principle. So therefore, we may have to scale down in our teaching of the students and assessing of the students aligned to the competencies listed.
Yes, sir. Might be probably we can check ophthalmology competencies where they might be expected to learn this in detail when they go to ophthalmology.
Yeah.
Yeah, we can look in the same curriculum document, and I'm sure they will have the same. So I don't think we need to teach them in detail about lacrimal apparatus from now on, as Praveen sir has mentioned. Can we move on to the next one? I think it's already almost 9. Would you all want me to continue, or shall we discuss the rest of it on Google Classroom? Your opinions, please. Shall we continue? No response. So I'll continue. Okay, 32.2, Group B is supposed to review it.
Ma'am, shall I?
Yes, ma'am.
Display my screen. I am Dr. Shantini.
Yeah, Dr. Shantini.
Shall I share my screen, ma'am? Or
yes, please do. I'll stop this 1 second. Yes, ma'am. Please share. Group B, anyone wants to discuss? 32.2.
Hello.
Yes.
Good evening, ma'am.
Good evening.
Ma'am, regarding SLOs, ma'am, the first SLO, it's been mentioned as describe the boundaries and contents of muscular triangle. Actually, we won't see any significant structures in muscular triangle, ma'am. So my doubt is it required to mention the word content of muscular triangle?
Contents, they must be meaning the muscles, right? All the muscles?
Yes, ma'am.
Yeah. Contents of the muscular triangle are the muscles. Right?
Muscles.
Muscles are there, no?
Yeah.
Floor muscles, it will come under floor.
That is the content, no, madam.
Yes, yes. There is content. Okay.
And one more thing, ma'am, regarding answer cervicalis, ma'am.
Yes.
They didn't mention about identify and demonstrate answer cervicalis.
Okay. Nowhere in digastric triangle or carotid triangle. Carotid triangle not mentioned.
Yes, ma'am.
I think in contents, I think they have just mentioned in general.
About
So can they break it down? Yeah. In carotid sheath, is it mentioned? Anterior wall?
No, ma'am. They didn't mention. They just about the extent, I think.
Formation we have given, madam.
Formation of
Carotid
answer
sheath.
cervical.
No,
Okay,
ma'am.
she mentions. She mentions
you mentioned
answer cervicalis. So since you have said contents of carotid and digastric triangle, maybe more specifically.
It comes under practical part.
Yeah.
So that should be included as a separate SLO, madam.
32.2, according to MCI document, it is K/S. Anywhere you have given that identify any of these structures?
Yes, ma'am.
Yes, yes.
Okay. So if you have given, probably she means that answer cervicalis should be mentioned separately. This everyone can discuss.
Yes, I think, ma'am, we can mention it separately, ma'am. Answer cervicalis, we can add that SLO, ma'am.
Okay.
As a separate SLO.
Yes, ma'am. You can ask for formation and even identification. Both can be done.
Ma'am, here the core competencies are like the ones which are must know areas. Answer cervicalis was never it never fell in this must know area. So should we really should be included over here? Is it that much required?
In deep
Just
structures of the neck, anybody has gone through competencies of deep structures in the neck? There, if we can find answer cervicalis anywhere specifically mentioned, probably we could have
Because
SLOs.
For
specifically
first year student, just knowing that something like called answer cervicalis is there is I think that much is enough. They don't need to always identify and tell us, because we don't take it as a must know area. We have never taken it as a very important point while going for examinations and identification part.
Can I say something, ma'am?
Yes, ma'am.
Ma'am, I think with regard to this answer cervicalis, in our institute, we have always focused on it because it is the main supply of the infrahyoid muscles. And especially, you know, that G1 fibers which the two things give out. So I don't know whether we can surely say that it is not a must-know area, because answer cervicalis has been coming as a short note. What I have been observing over the years as a short note for the undergraduates. I agree
even
that
I feel theoretically,
yeah, theoretically,
they
because
must know about it.
They have to know.
yeah,
Even if
because
they don't
yes,
observe, it will count.
yes.
But
Because practically,
is
I
it very
agree.
important for them to identify it also?
No, identify.
No,
The thing
maybe
is,
not.
Know
by the
about
time the specimens, by
identification,
the
is it
yeah.
very important?
But the thing is, by the time, what happens is, by the time we break out the carotid sheath, it's there in the anterior wall of the carotid sheath, the loop. So we just show them when we are opening up, and then it gets distorted, obviously, because you are going to expose the contents of carotid sheath, which are more important. But saying that it is not a UG, it's not a must-know area, I don't agree with you fully here, because forming an important nerve supply, I don't think it's
I
a
agree,
totally
ma'am.
avoidable area.
I think theory will be okay, ma'am. I think practical we can omit. Theory is okay.
Yeah.
Only formation is
Practically also, what I feel is that we can't, preserve it till long. That is why we don't ask them to demonstrate. Because most of us, by the time they come for examinations, unless and until you're preparing a museum specimen and asking it as a, placing it as a dissection specimen, specimens retain ansa cervicalis till the end. So
I just want to put a point here. Why we are discussing all this is, again, because the SLOs have been clubbed together. If they were separate SLOs for each of the contents of carotid triangle, whatever, must know area, that should have been an SLO. So that's what has been missing here. So maybe a specific SLO should have been put. Yeah, describe the ansa cervicalis in detail instead of identify it in a specimen.
Yes, ma'am.
That, okay. It's 9 o'clock. Do you all want to continue? Yes, ma'am. Yeah, you want to continue?
Break, ma'am, please.
Break, right? So there are two of them remaining actually. So can we discuss on Google Classroom? Okay, we'll discuss the others. Yeah.
Okay. Yeah, just one point I wanted to tell, ma'am. When we discussed the competency number 29, ma'am, it's posterior triangle. But in the competency itself, it's only sternocleidomastoid. So just now we agreed that whatever NCR document says, we have to agree. So posterior triangle is to be taught to the students or not taught to the students?
Exactly. That is why, like it is called, as Dr. Sheila has also mentioned, and it's been mentioned to us also in our regional center, that it's a living document and we can make suggestions to the expert group. Dr. Saikat wants chutti. So shall we stop at this? I know we will not stop because we are passionate about the subject. We'll stop here. We'll continue with these discussions again. Okay. Thank you so much, everyone. You all have been a great audience, great participation from all the resource persons. Today, all the resource persons discussed as well as all the participants. Thank you, everyone.
Ma'am, before you sign off, I'll interrupt you once, ma'am. So sorry. I think it's a request I'll make to everyone that please continue our discussion on the WhatsApp group regarding the posterior triangle. That's a very important area. And if the MCI document is not mentioning it, I think it's a blunder. It's my opinion, personal opinion. But I think because ma'am is right, we should wind up. It's 9 o'clock. But please, everyone, do continue our discussion even on the WhatsApp group regarding this.
Absolutely.
Yeah.
Even
Thank you so
one of the
much.
participants mentioned about the 2 competencies in histology and nothing else is certifiable. I guess that we can discuss as well. And this also.
Why only trachea and lung? Yeah.
Yes, exactly. Okay, so
Yes, thank
we'll
you so
stop
much,
for
ma'am.
we'll stop for the evening. Thank you, everyone. Good night.
Thank you, ma'am.
Good night, ma'am.
Good night, ma'am.